Platelets are cells that usually help form blood clots and stop bleeding. People treated in intensive care often have a low number of platelets or low platelet count in their blood. Patients are sometimes given platelets before a medical procedure to try and reduce the risk of bleeding. This is called a platelet transfusion. These platelets are collected from blood donors. However, platelet transfusions have some risks and may not reduce bleeding in critically ill patients. The threshold for platelets, or T4P study, will try to find out if giving platelets before a procedure is helpful. The study will include 2,550 patients from across the UK, Republic of Ireland, and Australia. Patients will be allocated randomly, by chance, to one of 5 platelet levels, known as thresholds. All these levels, or thresholds, are part of usual medical care. We do not know which level is best for patients. If a patient's platelet count is below their allocated threshold, they will receive a platelet transfusion before their procedure. If a patient's platelet count is above their threshold, they will not receive a platelet transfusion. Patients will stay in their threshold group for some procedures for the rest of their stay in the intensive care unit. All patients will be closely monitored. If doctors feel it is best to change the threshold at which a platelet transfusion is given, they will do so. As patients in intensive care units often need urgent treatment, they may already be entered into the T4P study. This is called research without prior consent. As soon as we can, we will ask the patient's family whether they think the patient would be happy to continue. When patients are well enough, they will decide themselves. If the patient or their family don't want to continue in the study, the patient will still receive the hospital's standard care. If they agree to continue, they'll be asked to sign a consent form. At 3 months and 12 months after entering the study, we will ask the patient some questions about their health and well-being. We will also collect information from their medical records. All information will be kept legally and securely. Patients can stop taking part in the study at any time without giving a reason. At the end of the study, we will make sure the results are made widely available. This research will improve the future treatment of patients in critical care. The research team will be happy to answer any questions.